All right. I really liked that Anna asked me to come here and talk about poop. And I think that's sort of appropriate. I spend a lot of my time talking about poop, and I think as veterinarians we do. In case you want to know about me, this is a lot about me right here. So all the stuff I do. The reason that I really have this up here is in case you're thinking I have a vested interest in something I'm talking about. I do. I'm interested in everything I do, and I have a vested interest in making sure that animals get healthy, and I have a vested interest in making sure that we change the way we practice medicine. So in addition, I also do a lot of consulting and things that does make me money, so that's useful as well. And I like money, so don't get me wrong. All right. I just wanted to start out to say, I'm talking about fecal transplants, and I'd like us to address who is the patient. So who is the patient when I'm dealing with this? And I'll tell you that I often think that planet Earth is my largest patient as a veterinarian. I consider the planet in my fancy practice, concierge wellness plans, that there is also a planet that I have to be taking care of as well. And I think we should all be thinking about that every day. So is that the patient? Are these the patients? Yeah, those are the patients too. These are my animals, and there isn't anything I like better than making them super, super healthy. But what about this? You may be like, well, you went back to the globe, Barb. That's not very good. But this is, in fact, a bacteria plate. And do you know they do artwork with bacteria on these plates? And they have like awards and a whole thing that goes on with that. And this is from the American Society for Microbiology. So these are the tiny patients. So for me, the population of the gut and the population of the skin and the populations of microbes and bacteria and yeasts on the body are also my patients. And if I got them to pay me, we'd be sorry, just kidding. Okay. So, but all of these things are part of who we're treating every day, what we're taking care of. If you have a pet, you're taking care of an awful lot of animals. So it's the bacteria, the viruses, the yeast, the microbial population in and on the body. And for me, it's the soil. And as was cleverly said today by Matt, we're really dealing with the entire terrain, right? We want the terrain to be healthy. So these are all things. They have interactions that affect immunity, the body, neurologic functions, nutrient absorption, the creation of nutrients in the body, and the biome acts as an additional organ in the body. And as we know, there are more bacterial cells in our bodies than there are our own cells, which is fun. So there's a lot we know about it, and there's a lot we don't know about it. We didn't know that you could make beautiful art from them until I saw these slides. So there's lots we learn. This slide has nothing to do with my talk. I love this bird. This is one of 750 in the world of whooping cranes, and I got to see one. This is in a suburban lawn near my house, and they called me up and said, there's a whooping crane. Can you come help us get this back to its family? This is a youngster, and it was one of the coolest things that happened to me because of being a vet. And I just love the way it's like, I don't know what to do. And that's how I feel. Sometimes when I'm talking, when I'm coming up with a talk, when I'm treating an animal, sometimes I don't know. I'm going to do my best. So there you are with the whooping crane. And if you think you can't replenish a biome, you can't make things better, you get an animal that is so down and you think you can't do it. There were 15 of these in the world. And now there's 750. I'm hoping there'll be more soon. But that can happen, and it's amazing. And my slides won't go forward anymore. That's it. We're done. Thanks. I'm sure there's a way to do it. Here, I think it says, I have to say okay to something, do I?
Yeah, it's fine.
Out of power, out of... I think the bird scared them. This is a very tall bird. By the way, the bird is this tall.
Sorry about that. There was a pop-up that came up.
Pop-ups, honestly. Okay, so, all right, so there we are with the art. Look at that. Is that so cool? Just forget what we do with the microbiome. This is amazing stuff. Okay, So, and we understand things go wrong in our world. We do all kinds of things. Like when we cook food, we are sort of destroying a lot of stuff, but at the same time, it tastes so good. So there's that. We give, antibiotics. We do a lot of things that we have to do, but other things go wrong. We think we know what we're doing, and we don't. You introduce an animal into an environment, and you're like, whoops, it just killed everything. We talked about that with the Yellowstone changes that happened when we took the wolves away. Like, such a bad idea. And then it's like Humpty Dumpty. How do you put all the pieces together again? Well, it's, just do your best, right? So, sorry, I had to put this on here. It really isn't totally related, but I think it's fun to think about what does color mean in a pet's poop. I have a lot of people ask me this. You're always getting questions on the phone like, there's something yellow coming out. Okay, you're grossing me out and don't do it. But all of these different things, I just sort of wrote up a quick list so that I could just have this for clients sometimes, and they like to read it and think about it. But there's a lot that goes on when you get different colors. The one that was relevant to me is this, when it's sort of this green stuff, and it's not necessarily goose poop or something like that, which is its own problem with different types of bacteria that are specific to goose poop. The Clostridium perfringens is very, very high in goose poop, in case you didn't know that, and you can get some pretty serious disease from that. We have a big Canada goose population around us, and I see that sometimes. But it's, when things don't move properly through, then the bile that's in there doesn't get properly digested and taken care of and turned into the brown stuff, and so you'll see green, and that was of interest to me when I first started learning about poop. Gas. A lot of people talk to me about, my dog can clear a room with the gas, and that's just dogs. Dogs just do that. I'm like, actually, they don't. Actually, they really don't. And so you should know that when you have gas, it can be a lot of things. My first thought is always, what kind of microbiome imbalance is going on? What kind of dysbiosis is happening? Obviously, dietary indiscretion. My dog's favorite thing is to try to manage to get to the compost heap, which is a bad idea, by the way, at the farm, and eat something there, which has happened a couple times, and I pretend like that wasn't my fault. There's motility issues, there's anxiety that can do that, there's just air swallowing and panting and different things like that, breathing issues, organ issues, enzyme problems. It could just be a bad smell from someone else. Anyway. All right, so then how did I get here? How did I get here talking about poop to you guys? Well, we have to think about what's gone wrong, right? So, and I'm sure everybody's talked about it. I'm just going to do a quick moment here that pets can't inoculate themselves with microbes. They sort of need to get them from their world. So when we, have animals that live in high rises, we have, our cities, we have chemicals in our lawns, we have, do you need me? I'm just going to be helpful. I'm just going to keep going. You're so cute, though. She's so distracting, isn't she? Yeah. All right. We have all of these things that can really disrupt what's going on, and at the same time, we're not really replenishing it. Of course, we're going to have problems. So sometimes these normal biome interactions are missing. They're not rolling in disgusting mud or doing things, and sometimes we're giving them all these different meds. Sometimes we're feeding them the wrong food. And sometimes when you unbalance something, you can make it completely extinct in the body, which means sometimes you're trying to support I gave so many, I gave probiotics and fiber, and I've done all these things, but it wasn't the right bacteria, and you're not feeding the right bacteria, or you're trying to feed a bacteria that just isn't there to eat it. So you have to remember that those things could just be gone. So figuring that out is part of our job. And I find that some of the most troublesome bacteria are the ones that are coming from the most sterile environments. So people are like, we clean everything. There's no way my dog has a bad bacteria because our house is pretty sterile and we never let the dog outside and the dog poops on a little thing and it's like, yeah, we're going to have some trouble, right? But bacteria, they're incredibly versatile, right? They can manage to figure something out. They'll overgrow. They do something in a second. But luckily, most bacteria use their powers for good, right? They really are. They're not evil. Pathogens, as we talked about earlier, pathogens are not necessarily just, if you say salmonella, that's a pathogen. It's like, actually, it's there because it also has some power for good. And if you are the right strains in the right amounts, that's what we're talking about, is where is it? Is it in the right amount? And can we foster that and make that population in balance? And that's what you're looking at. So, what am I talking about? I'm talking about a liquid enema prepared from feces of a healthy, pre-tested pet, a cat or a dog. I use that to repopulate bacteria in the intestine of an unhealthy pet. How often do I do this? Surprisingly often. I will say that I am sort of, the same thing that Matt was talking about. I'm trying to do this before I get here by giving them the appropriate food, doing some supplementation, paying attention, testing, looking at things. How are their other levels? Can I address the terrain? And do I have to do a transplant? Often I don't, which is great. So often my life is very quick. Hi, you're feeding the wrong food. Here are some supplements. We can do this. And then sometimes it's, wow, I cannot get anywhere with this pet. And I've been trying, and we've been doing these things, and this is a fecal transplant. I don't wait too long. I'm not waiting until it's like the owner's like, this is so annoying, I'm not trying another supplement, and I did change the food, and I did do that. What we're doing is sort of working along the way and saying there's always a possibility that we'll use a fecal transplant. Because it's not difficult, which I will show you. Hopefully by the time you're done with this talk with me, or just done with me entirely, that you can all do your own fecal transplants at home. Do them at home. Okay, so I use it for many, many, many things, and the list is longer than this. So chronic loose stool, diarrhea, constipation, things like that, yeah, for sure. Diseases, allergies of the skin, hair, and hair coat. I do that for sure. Immune diseases, cancer, behavior, anxiety, cognitive issues, chronic inflammation, that includes arthritis and other things. Organ disease, yes. Malabsorption issues, anemia, albuminemia, when they're just not absorbing or doing things, and I can't figure it out. I've done other things, fecal transplants are amazing, right? So, if I know for sure they've done chronic antibiotic use, for sure, I'm going to do that as well. You get an animal that's come through maybe having parvo and everything else, tons of antibiotics, yeah, you'll want to do something like this. So there's a lot of reasons. So here we are, making it, and that's sort of the thing you're putting it in. What? Where did you go? Cool, that was it. You got to see that for a second, but there'll be more of that if you want. All right, so, and cats too, yes, right? And with fecal transplants in cats, I just want to make sure that you're asking about litter when you're talking about what kind of litter, because there are so many kinds of litter now. Everybody wants to sell you something, and the litters that are out there, some of them are horrifying to me, right? So something made out of an industrially farmed corn product or wheat product is going to be full of whatever chemicals and things they use. It's the worst of the worst. They're not actually using it for food, obviously, so they're going to be giving you whatever's left over. You don't want to use those types of litters because the cats are not just pooping and peeing in there, they're walking in it and they're licking it and they're getting it on their fur. So it's a big deal to not have the glyphosate and chemicals. The minute you do a fecal transplant, they go in the litter box and then they kill everything. I mean, not everything. Remind yourself also, I just want to take a second for this, when we're talking about the gut biome, even though we're talking about how it goes astray, it's incredibly resilient. So don't give up on this. Like there are bacteria hiding in those crypts. There's things we don't know about, but it's incredibly resilient. You can give a course of antibiotics and they can come back and be fine. So sometimes I just say, no, we'll just do this and we'll see what happens. And then they're fine because you just feed them back and the little bacteria who are hiding in the crypts are like, all right, I'll come out again. Right? So don't worry about it. You can do that, but at the same time, don't actively kill them by giving pesticides and things that are inappropriate or feeding carbs inadvertently by having them lick them off their paws in the litter. So I also, with cats, because of the biome thing, I feel like we don't address dental issues enough in cats, so I do talk about that. We do no anesthesia dentals, and it can be very effective, and they don't have to go under anesthesia. And then stress is always one of the things for cats. But so I can't resist because I did go to Africa. And it was my life dream because I live in Chicago, and the idea to just go there and watch an animal eat, it was sort of life-changing for me and also just cool. But this is pretty removed, obviously, from our cats, and the big cats, and evolutionarily, and what they're doing is different. But what you see here to me is the cycle of life, right? So, and everything eats everything. The vultures are waiting patiently until this guy puts down those bones. But the cool thing about this is he's actually carrying the head. And if you can see, I don't know if he's going to walk along, but it's a really long video. Do you want to just sit here quietly and watch? So he's going to carry this along, and it is go ahead. What he's carrying is the head of a giraffe. And they've eaten everything out of that. And obviously we were talking about the different types of fibers, and we were talking about all kinds of other things. But, I mean, how weird is that, right? I don't know. You don't see that in Chicago. But they've eaten all the stuff. There's still a lot of fur, and we're dragging these things around, and they're picking up who knows what on the ground there, and they're inoculating themselves all the time. And that's what I'm talking about here. So we're treating indoor animals. We make a plan when we do this to address both the internal and external environment, keep the whole terrain, and keep the biome healthy after the transplant. So, I mean, that includes so many things. They've shown how exercise improves your biome, and I think that's amazing. So the things that you think are healthy, they're really healthy. They really help. So, having, look, the kitten jumping. Oh my God, kitten videos. Okay. So yeah, if you're doing that and thinking about doing all this, putting stuff up the bum, don't just do it and be like, we're done, which I know is happening now in conventional medicine and things like that. They'll just keep doing them. We were talking about this, Matt and I, how sometimes people are just saying, we're just going to routinely continue to do biome transplants, basically putting in a fecal transplant regularly. We shouldn't have to do that. You should be able to fix the environment if you can and get things going. Also, just weird. This is an elephant that died in this water, and crocodiles that swim around and eat. I mean, everybody does everything. This is what happens in the world, right? So again, remind yourself, eating and drinking is messy business, and it should be. We talked a lot about fiber. I won't go into it. I was going to maybe mention some stuff, but I do think that there are fibers we're missing. I think we have to use a lot of different types of fibers, but whole food fibers are really good. Obviously, I went to the feathers, beaks, things like that a lot of animals will eat, and I do feel like there's some benefit to that. I don't grind up feathers and put them in, and I don't really recommend the feather protein food that's out there. Yowza. All right, and then just again, this is actual dogs eating. The wild dogs in Africa, you see your dogs pulling, and they love the tug of war because this is what they do, right? So those are my dogs down there playing tug of war, and then you have this going on, and there's sand and dirt and fibers and things. Who knows what they're picking up? It's so great. But there's going to be plant matter fiber in there as well that I believe is part of what they need to do, and swallowing the whole bone and all of that. I have a video from Barbara Fougere feeding a chicken wing to her cat, who just literally just devoured it. And it convinces my clients that they can do that, which is cool. One thing is skin biome matters. So I do pay attention to everything, the whole terrain, right? So I don't want people to overbathe. I talk about the healthy nature of the skin biome, and that the skin isn't just the skin. The skin is the oils and the bacteria and the yeast and everything that live on there. And if you scrub all of that off every month, the body's like, oh, I got to make that again. And it's a big ordeal, and you can get drier and drier skin. So bathing, I tell people, if you only bathe once a year, that's fine. Obviously, when my dogs get skunked, which one dog got skunked 6 times in 1 year, she is so stupid. In fact, it's this dog. I actually one time was walking her, and I had to carry her away from a skunk was running at us. I'm not kidding you, down the sidewalk in my town, and running at. I just like, there's a skunk running at us. Oh, that can't be good because they can have rabies. Anyway, so and my 80-pound dog was like, I'm gonna get that skunk too, and we're on a leash. I'm like, no, we're not doing this. So I have to carry her. I'm running down. People are like, you're the veterinarian in the neighborhood bar. I'm like, carrying my dog. Like, what an idiot. I had to carry her 1.5 blocks to get her away from that skunk. Anyway, I'm sure I'm taking time. So bathe infrequently. Try not to use brushes and things that pull out good hair. People don't think about that. Just because someone sells it as a dog brush doesn't mean it is a brush. You can sort of start destroying the biome from the outside in by just ripping up the skin and doing dumb things. So use things you'd put on your own forehead and run through your own hair. That's my rule. Oil-based, simple, non-detergent shampoos, and then don't use perfumes and all that stuff, preservatives and things like that. That does make a difference as we're getting this. So all the things I've talked about seem like it is sort of a perfect storm to make a biome problem, and we have that. I think we have it in our world already. We've got it, right? We've got all the different things that can destroy all of these biomes, but we do have a very good answer. So this is also my dog. She is one of the donors. She's also a weapon. She's a Belgian Malinois, as you know, so she's hilarious, but the sweetest thing. But yeah, when she comes running at you, no matter what you want to flatten on the ground. But she's a very good candidate because she's pretty together. So we use our staff pets. I have a couple clients who keep their dogs really, really well, and we use some of them. Anybody that will regularly bring in poop, but we have to do a whole bunch of testing. So one is we make sure that they are eating preferably a raw food, commercially available, approved company. We go through companies and say, yes, these are the ones we can use because I know that they've balanced really well. I'll run their formulas through the Animal Diet Formulator software. We'll evaluate that their fatty acids are balanced, a whole bunch of other things I'm looking at. And then we make sure, or they can be doing a balanced homemade with a good recipe. If they're really doing it and there's not drift, which happens, they can do something lightly cooked. I do avoid anyone who's feeding canned or extruded kibble. It can contribute to a dysbiosis in there. And we did talk a little bit about how sometimes if you have an animal that's what they're eating and you're doing a fecal transplant, you might want to match those two and have an animal that's donating the transplant be a kibble or canned eating animal. I never have to do that because I'm really, really convincing and I convince people to change diets. But I don't say I never have to do that, but I really try not to. I really do feel like it's better for the biome if they have better food, but every so often I might do it. And then we're supplements, we'll encourage that they periodically get a omega-3 fatty acid supplement maybe a couple of times a week, not every day. We don't do that because too much and too little omega-3 can look the same, and everyday supplementation I find gets to be too much. I use a variety of fibers in these animals, and I believe in the probiotic foods and herbs, as Matthew was talking about, rather than the supplements. I really do try to avoid using like inulin, for example. I don't think is very helpful. I don't usually use that one, even though it's been so popular. But if you're doing whole foods and things for that can be helpful. And obviously, they shouldn't have any gut-altering medications like antibiotics or steroids for at least 6 months before we're testing and using their poop. And they have to be evaluated by a vet, and we need to do these screening tests. So the screening tests that I do include these things. So they need their basic blood work annually at a minimum. Usually these animals are doing it twice a year. My clinic pays for it, so people are happy to do it twice a year just if they can get in and do that, that's great. We make sure they have appropriate weight, dental condition, hair, coat, and health. We are looking at body scores, not just the body condition score, but also the muscle condition score, which we do in our exam. And they need to be sort of age appropriate for this. I usually make sure that they're adults, so that they bring whatever that is with their immunity, and I don't even know. There's a lot of stuff I don't know, and I want them to be adults. I want their biome to be adults too. So I do that, and then I don't want them to be too old because I also feel like maybe there's something in that. But you could do age appropriate old to old, things like that. Not a bad idea. Because again, we don't really know. But I do a parasite screen, we do a pathobiont screen, we do microbiome testing, and these are some of the companies that I use. We do inflammatory markers now. This has been more of a new thing for me where I want to just look and see how are they doing and make sure we have a little bit of cancer markers to make sure that those are okay as well. The retesting I will do every 6 months on these. And so, it's sort of expensive, but then again, I charge appropriately for the transplant. And then I'm making sure that whoever's donating, that they're making sure they tell us if there's a change in diet, medications, or supplements that might affect their microbiome. So feline candidates are the same, and obviously with feline testing, there are available feline fecal transplant material that you can buy. So you just have to, it's one of those things I keep asking, do you have a raw fed donor in cats? Which is a trickier thing to find. All right, so sample collection and preparation. You need a dedicated blender mixer. You need a kitchen gram scale, a fine mesh strainer, a 500 ml or greater bowl or graduated cylinder, a silicone spatula, mixing spoon, sterile saline, 50 mils of the specimen ampules. It says 50 here, and actually it's somewhere between 15 and 50 in these little ampules because I've got smaller animals more and more. And so I'm now doing a smaller thing. And I brought with me in my little bag, you can stop with that, but in my little bag is a just a sample of what our ampules are now that we freeze in. And now I'm worried about the plastic in there, so don't talk to me anymore about that. But we freeze them in these little plastic vials, and I probably should be doing all of them in glass, so I'm sad. 60 ml catheter tip syringes and glycerol solution that you need to add to it when you freeze it. The collection, when we collect the samples, we try to get rid of any kind of debris that's in there. Although the debris being in there is not a problem, you just try to make it not in there so it doesn't clog up things, because actually that probably adds to the biome, which is fun. And then you can refrigerate the sample for up to a week before you use it, so that's sort of fun. You can collect them all and do them all on Thursdays. And then you don't want it to freeze or dry before you process it, so you need to keep it pretty well in the fridge. You weigh the stool sample, exclude the debris. You prepare a 1-to-4 ratio of stool to sterile saline. So it's like 250 grams of stool and 1,000 mils of saline. You will then take that sample and you will blend the stool and the sterile saline on low power on a blender. By the way, that blender is not usable for anything else. If you try to make a margarita in there, which I, of course, didn't do, it's going to taste like poo, which I wouldn't know. Okay, so, and then you do a high power blend for 50 to 60 seconds until it's all uniform. And then throw the blender out. No. And then you strain the mixture through a fine mesh sieve into a bowl or cylinder, and you use a spatula to press it through. You can store extra fecal solution if you're not using it that day for up to a month. And when it's frozen, you add 5 mils of glycerol for every 45 mils of solution. That went silly. Before freezing, so you put in the glycerol solution. There's some conversations about whether or not I'm going to really want glycerol going up the bum. I haven't figured that one out yet. So it's better for me if we try to do a bunch of them within a day or two of making it, which we sort of try to schedule, and then we freeze the ones that we have extra, and I can still use those. I haven't seen a problem with it, and I'm not sure that it's an issue with the glycerol, but I'd love to see a study on the differences between that. Okay, so we transfer the prepared fecal solution into these little 15 mil ampules is what I'm using now, and then you seal them tightly, and then you label them, because I want to know, is it canine or feline? Who's the initials of the donor? And then I have the date in numbers just across the way there. Did you find the bag with the little ampule in it? It's my cloth bag, sorry. My assistant, Sean. Thank you, Sean. Also my son. Okay, so, and then you store them upright in a pharmacy lab or a freezer. Okay, so the transplant protocol in general, you get rid of any kind of supporting or supplements or things like that for 2 days prior to doing this procedure. So you tell the owners you're going to get a fecal transplant 2 days before, stop any of your probiotics, prebiotics, anything else you're doing. Feed appropriately so that we're keeping the terrain ready for the bacteria. And I will sometimes tell them to go ahead and do some of the more food-related things that I know are going on. Like if I have an animal that is taking something like ashwagandha, I will include it because, as Matt was saying, I think ashwagandha is magical, which I hate to say in a scientific thing, but it does seem pretty amazing and it can be really helpful. So I will keep them doing that. There's probably other stuff in there too, but it's fine. I brought show and tell. And then we fast them 12 hours before administering, just so that we're not having a ton of poop coming all this way. We just fast them for 12 hours, and then they can have water, obviously, or whatever. But this is the size that I'm doing. So if you want to, at some point, you can take a look at that plastic thing that I'm now really thinking twice about. Okay. Then we give a cleansing enema before doing the fecal transplant. I will just do an enema of warm water and a little bit of lube, and we'll put that up the bum and then try to just get out what we can and then let them sit for a few minutes. So we'll sometimes digitally check and do things like that and just remove some of the things that are right by the bum. And then we use the fecal solution, 5 mils per kg. We use a 60 mil catheter tip syringe and with a wide bore catheter, like a 12 or a 14 French. well, it's actually no, that's supposed to be 8 to 14 French. Because it depends on what you're putting it into, obviously. They're not put under any kind of anesthesia, so you do need it to actually go smoothly and make it easy. It is pretty liquidy by the time you've gotten it through the mesh, so it really will go through anything. And then you measure the catheter just so that you can have an idea where it's going to hit the transverse colon, and then you put it in that amount into the body. It's usually you're putting in most of it. So in the sort of medium-sized dogs. So, and then before you do this, you might want to take them on a quick walk right before they go, just in case they want to poop something out. And then the fecal solution, you want it to be about body temperature, and then you administer the total volume very slowly at about 1 ml per second. And then after the patient, you want them to be standing for 15 minutes, not sitting or anything else. And in fact, if you can elevate their bum a little bit, that's helpful too. I've got this is our chart, which came across sort of badly. The little lines in front of every number is not a 1. Those are just lines in front of every number. But if you want something like this, I actually have a better version of it. You can always let me know. Or you can have that. If anyone want to take a picture, I don't know. It's really obvious stuff because it's basically, the 5 mils per kg. Okay. This is doing it. Sorry for anyone who hasn't had breakfast or eaten. But yeah, so you're just basically going up the bum and you're putting it in. And so the solution you can see is a little brown. It looks pretty thick, but it actually is pretty thin, and it goes through pretty well. And I will say that, particularly like this dog, for example, it was an amazing response. One time sometimes, and people are like, oh my God, I can't believe we've had normal stool for like 5 days in a row, first time in a year or something. So things like that happen a lot. I tell people it could be anywhere between 1 and 6. I can't remember the last time I did more than 3. So we wait a bit, and then we might do another one. Might be a few weeks later. We might see how things go, and so that's sort of the idea, but 1 for sure. Post-transplant guidance for owners. The first bowel movement may be delayed for up to 24 hours. I warn them about that. They're like, my dog's completely constipated because I'm like, your dog's just not pooping. It's fine. It's empty. I emptied things. And then it may be a little looser than usual because things are happening in there. As we say, we're sort of putting in all these bacteria. It's like a whole population going into a huge room, and they all have to sort of sort themselves out. So it's that idea, which also we were talking about, creating chaos. Like, just make an insanity in there, and everybody's like, "Whoa, no, this is my spot. This is my spot." I can just picture it, like a party at my house. So yeah, that's going on, and then things start settling down. And then we have them monitor and report any GI upset following the transplant. We use foods and herbs that generally support and feed the microbiome as they're going along. If they're doing stuff, I'm having them get right back into it. Again, I mentioned ashwagandha because it is one of my favorites. I use a lot of mushrooms. I use turmeric. I use ground walnut, polyphenol options. And there's a lot that I want to be supporting in here. Some of it, I'm not sure why exactly, but I'm doing it because it seems to work. The things that don't work, I don't use. I don't use inulin. I just have stopped. I'm 30 years in now, and I've been doing fecal transplants for over 10 years. I know certain things that work, and I know things that don't work now. And some of it I don't have science for. But I'm like, that just never works for me, so I'm not doing it. Surprisingly, if you put a tablet, like a 500 milligram tablet of spirulina in a little bowl, cats will just come over and eat them. Did you know that? Like, I haven't had any of my patients ever tell me that their cat just didn't walk over and go, oh, and eat it. In fact, I left 5 of them in a little bowl once, and they were all gone. I love cats. They're the weirdest. But there can be a fun supplement for them. So you want to avoid the empty probiotic supplements, and there's a lot of them out there. As I said, inulin I don't love. I'm sure it's got its uses, and whatever, but it just doesn't work for me. And then we follow up a week to talk with them about it, make sure nothing's just left to go. And I always recommend retesting of the fecal biome about 4 weeks post-transplant. So we do that. By the way, when I'm doing this, the reason I'm doing it is not just because things aren't going well, but I've also tested the biome. I don't think I mentioned that. Hi, let's start over. Before all of this happens, we are definitely doing biome testing of our patients, right? And seeing where they are and trying to figure out how much of a dysbiosis is going on. I will also tell you that often I get a biome test and it's normal. I'm like, okay. And things are all wrong. And I'm like, okay. And then I do a fecal transplant and things are right. So we clearly don't know everything. So often that's the case too. So don't just be like, oh, your biome must be perfect because the test came back normal. That test is so limited. So just remind yourself that go with what's in front of you and try to figure that out. Maybe you're missing something else more important, so keep looking, but it's not necessarily that test is going to have every answer for you. All right, and then we tell them other fecal transplants may be necessary. Typically, it's 1 to 3 for us, and then we're going to want to follow up. Well, this is just make sure you clean up. I love that this is on here. One of my techs told me make sure to put in the cleanup afterwards, that you have to use really good cleaners. I'm like, well, I think we know that, right? It's poop. Okay, nutrition matters, so obviously we're going to be talking about the nutritional things. I don't really know where I am for time anymore. It's been 2 hours now. So we're going to be doing, I always talk about nutrition because I have to. It's like a compulsion. So ingredients and nutrients will matter, the macro and micronutrients, and the balance matters. I find fatty acids are super important for this, and making sure that you've got that. I want, obviously, fiber, non-nutritive fibers. I want pre, post, and probiotics for the microbiome, depending on what's going on and what I need. If I know that there's absolutely no Hiranonis in there, I will try to do a supplement that has some as well, sometimes even after I do the fecal transplant. It just depends. So I'm looking at how they're doing a couple weeks later. I may be adding those things in. I'm going to be paying attention to sourcing at all times, again, for the globe, because I don't want anyone to farm by using all these different pesticides. So I'm trying to encourage and giving money to people who are doing the right thing out there, but also I don't want any of those kinds of chemicals in my patients at all. And then I tell people about different things they can substitute. I give them ideas for, you can add an egg, or you're cooking mushrooms, go ahead, feed mushrooms to your dog or your cat. And then talk to them about how nutritional stressors will affect what's going on. And then we make sure we have a long-term plan, know what to avoid, and we do follow-ups and we retest. So these are some of the biome support, or for testing that I use in my area. I'm not sure what's available in your area, but you can send a lot of these in the mail. It's my favorite thing, poop in the mail. Like, oh, what's in here? Sorry. Okay. And then I do a lot of other testing that I just thought I'd put out there. So I will be checking vitamin D. We'll be doing nutritional panels. I will be doing that inflammation panel and the cancer panel, looking for markers. I tell people to try with dogs to feed, particularly if I've got a lot of biome problems, I will tell them to try to feed once a day with a dog, because they need that empty time for metabolic cleanup. And often that works better than feeding twice a day, or 3 times a day, or 4 times a day. So that usually works really well for me. Obviously, there's animals that doesn't work for. Omega-3s, I usually remind people it's 2 to 3 times a week, not every day. I'll use nutritional yeast, get the B vitamins in there, so nutritional yeast can be a really fun addition. And then I talk about the feeding architecture just to sort of try to keep things together. So what that means is that what the form that the food is in can matter to some degree. They do need to do some chewing and things. We need the moisture to be there. I don't want it to be, a lot of people say, oh, I add like 2 cups of bone broth to every meal. I'm like, your dog eats soup every day? Like, I don't think that's that fun. I don't think they expect soup every day. So we try to change that up, and not too hard. Like I don't like a kibble food that much. I want it to be moisture appropriate for what their body expects. I want the food bowls on the floor. I don't raise food bowls. If you picture trying to swallow with your head up, trying to swallow with your head down, it's easier to swallow. You swallow less air, you're not going to be swallowing as much, that's going to change what's happening in the gut. If they're constantly having their head more up and swallowing more air, it is not a helper for bloat to have the bowls raised. It's just not what I see. You don't need to slow a dog down when they're eating, and then you'll want to be sourcing and doing things like that. And then, yes, I have them chew bones. I like them to chew bones because it's very calming. It's also really good for them. They need to be long enough to do, but it tends to do so many things. It's use it or lose it in the head, and so they strengthen their mouth, their periodontal ligaments, and everything when they do that. Oh, look at them. There they go. Hi, puppies. They're all so happy. Look at that. Every part of the tooth is being taken care of right there. My dog's teeth are friggin' gorgeous. This one in the middle was, I don't know how old he was when he died, not just a year ago. Maybe near to 15, 16, and his teeth were gorgeous. Look how cute they are. So if we're paying attention to the entire terrain, we're talking about the species Umwelt of each animal. So what are they thinking? What are they doing? So for me, my cat's always thinking, why are you in my nap place? And my dog is always thinking, what's for dinner, right? But you're paying attention to the species in front of you because that's what we, certainly as veterinarians, that's what we do. But as pet owners, that's what we do. Don't think everybody's the same. They're not. And we need to pay attention to what that is and what the species of bacteria that live on them. So we're trying to pay attention to that. We are dealing with the normal canine eating behavior and trying to mimic that and making them healthy. So that's what this is about. The microbiome is delivered in the food and the environment in nature. We can't do that so well in our homes, so we're going to be doing these different supports and paying attention to the bacterial and microbe population, the diversity, the richness. We're going to do important things for the GI health. We're going to have all kinds of biological feedback from the bacteria that over time, I think as we learn, well, oh, you're having that weird thing going on. We're going to know that's this bacteria even if we don't test for it. So we're going to pay attention to all of that. I did put this in here just for grins because the sourcing is so important to me. I have a list that I do when I teach nutrition, and I have it as an exercise for my students to find out about it, call about a supplement, call a company about a supplement and try to find out as much as you can about that supplement. And here's a list of questions you can ask. And it's really helpful to get you in the habit of knowing who's supplying the food you're feeding. And as a veterinarian, I have my staff do this for a lot of the supplements that we recommend. And just so that I know. Like, where do you source it from? How is that processed? What are we doing? Are you paying attention to the world? And do I want to give you my money? Or do I not? And I think it's important that we're paying attention to that. We all love animals. We should love the food animals that feed our animals. We should also love the planet Earth that also feeds us and the soil that's there. So this is just up there if you want it. I talk a little bit about bones. We won't go into that because it's silly, but there's a lot of stuff about bones. Yeah, so we won't do that. Oh, because I forgot you're doing that. That's actually why I actually was going to take this out of here, and I didn't. Okay, so what else can you do now? Well, yeah, you can come and take courses if you want to at CIVT next. You could get the ADF software. We've got the things that we're giving away. Keep in touch with each other. Let's do that. Know that you can keep in touch with me if you want to. I'm in Chicago. You come by, come and visit. I have interns, I have people come down and follow me all day long. I don't know why, it's scary a little bit. I'm like, why are you following me? But they do, but I'm always happy to have people come and stay. Support integrative medicine by donating here. Obviously, the best work, I think, is done here. Because I love you so much. And then, but there's other organizations as well, and the Royal Animal Health University Foundation will also be funneling money here, so it's just a place to collect for my people. We've got discounted subscriptions for the ADF for you if you want to do that. And then, yeah, CIVT also. If you want to do the certification in veterinary natural nutrition, there's a discount there. And we also have a discount for a webinar package if you like. Did you already decide who gets this?
No.
Oh my gosh.
But you can tell them
Okay.
what it
We
is.
also have a raffle for the 1-year free associates membership for CIVT, which there's just tons of fun stuff there. So if you don't know who Barbara Fougere and Steve Marsden are, maybe you should start looking things up because they started this college and now I am in charge of it. So I'm trying to make sure that it does, keep on going because they're going to be mad at me if they're not. But they're both still working with us and we all work together now to do this. And you can win this in the raffle, which is really fun.
Super.
I think that's it.
Thank
So
you.
that's it. Yeah.
So I guess that while Robin is trying to find it's on the white one there. We will have one question about fecal transplant, if possible.
Yeah.
There's one. Oh yeah. Sorry.
Oh, the thing.
I'm really bad at these things.
Close, really close.
Amazing presentation, I really enjoyed it. And so my question is, have you ever had any success with fecal matter transplant for obese dogs?
Yes, Yeah, I don't know if that was in there, but yes. I do feel like it's very important, particularly I have had a couple animals because they're metabolically deranged. Sometimes it's a hormone problem, sometimes it's other things that maybe I just haven't gotten a handle on, even though we've looked at Cushing's or we've looked at things. Sometimes it's just, obviously there are bacteria that we know can affect absorption and fat regulation and some of the feedbacks that for satiety, things like that as well, but also specifically metabolism. So I don't think we know enough about it. But yes, when I feel like I'm getting to a place where they're just like, the dog is 104 pounds and it should be an 80-pound dog, and it just keeps happening, and we're feeding the right food, and they're feeding like half a pound or something every day. I'm like, all right, time for a fecal transplant. I try not to wait too long, but it does work. It really seems to help. I've had 3 cases in the last year like that.
Amazing.
Yeah.
Thank you.
Yeah. Yeah, Fiona? Ooh, nice catch.
Lovely presentation. Thank you so much. Whenever you talked about the testing that you do in the microbiome for the donors, what is that criteria for how diverse the microbiome needs to be? Is there something you're particularly looking for?
Yes, and I'm using a little bit of the company's assessments there, but I also look through myself. So because I was doing this early on when the testing was even sillier, I have an idea, I think, about what I'm looking for in terms of the spread of the bacteria. So it's a little bit more of a, thing, but you can just look at them.
Gut feel?
What?
A gut feel?
It's a gut feeling. That's really funny.
Thank you.
I wish I'd said that.